Broadcasting from the business capital of the world, this is the Podcast Business News Network. Ketamine is Hope, and that's the website, ketamineishope.com. We're here with the owner, and Julie Addis is here to talk more about the ketamine IV therapy clinic that she runs, and of course, all the treatments that ketamine can benefit those who may be suffering with anxiety, OCD, PTSD, depression, suicidal tendencies, and so much more. So we're excited to have her here today to get to know her as a CRNA and all the work she does. My goodness, and there's a lot that you do. So first and foremost, how are you today?
I'm good, Jill. How are you?
I'm great. Pleasure to have you
Good.
here. And you're
Thank
located
you.
in, it's in South Bend, Indiana?
Mm-hmm. Yes, we're in
Great.
South Bend, Indiana. Yep.
Beautiful. And obviously, you're working with clients in just your state, or are you able to work out of state as well?
We have some clients that travel here from Michigan also. Yeah.
Perfect. And I know you
Mhm.
understand many challenges of people that are, dealing with, regular traditional treatments that are falling short. So, tell
Right.
us a little bit about what ketamine is, and ketamine therapy, and what it can do for someone. Because some people might not even know what ketamine is. They think it might be just a street drug. I mean, people don't know. Could you share a little bit about it?
Sure. I know ketamine has been around for a very long time. It's used in the operating room as a for pain and for anesthesia. And in low doses, it can really help a lot with the mood disorders and people struggling with the depression and the suicidality. It's a very safe anesthetic. It causes dissociation, which means patients kind of go into a dissociative state where they may see shapes, colors, maybe different people, different times of their life while the infusion is going on.
Mm-hmm.
And it's just a very safe drug. It's low doses. We run it over 40 minutes and it increases the glutamate in the brain, increases
Wow.
neuroplasticity in the brain. So tremendous. I mean, it's just really, I think, the tip of the iceberg
Great. Well, we'll
because
talk
there's
more
a lot.
about the benefits and the
Yeah.
type of people that can benefit from this in just a sec. I would like to find out more about you first because you always wanted to be a nurse growing up, right? Tell me where you grew up and tell me a little bit about this passion you had for helping people at a young age.
Yeah. I grew up in Avon Lake, Ohio, which is west of Cleveland. And yeah, I mean, I just always knew I wanted to be a nurse, which nowadays I guess is, a lot of people really don't know what they want to do. So I went to nursing school and started working as a nurse and then got interested in nurse anesthesia. And I've done that for 25 years now. And just really over the last few years, I've just seen more and more patients struggling and patients on a lot more medicines, but not really equaling a benefit, so to speak. So that's what
Oh,
kind of got me researching this.
got it. Well, hold
Mhm.
on. So walk me through now teenage years, young year. When did you go to school? Where did you go to school?
I went to Ursuline College, which is in the Cleveland area for nursing school. And then for nurse anesthesia school, I went to Case Western Reserve in Cleveland.
Wow. And tell me a little about, who was your mentor? What was your family life like? Did you have anyone that inspired you to go down this path?
No, there wasn't any nurses in our family. No, just me and my sister, and really no other family members were involved in nursing at that time.
And I know you mentioned something about there was a female anesthesiologist. Is she the one that kind of helped you along the way? I read your notes
Oh,
earlier.
she was just very inspirational to me and just some of
Yes.
the things that she would, talk about just as she would tell stories of when she went to, med school as a woman, and just rising above things. But yeah, that was one of her main mottos was you always find something somebody did and tell them about it in public
That was
and
it. Yeah.
criticize them in private. Sounds
Got
so simple,
it.
but people don't do that.
I
Yeah.
know. It's so true. So wow, that was it. I remember the story now. Okay, great, great. So
Yeah.
now let's talk. So as a nurse, where were you working? And then how did you transition onto this side?
Well, I started working as a nurse in the Cleveland area, then I went back to nurse anesthesia school, worked in Ohio for a while, and then moved out to Southwest Michigan. I've been working in the Indiana area now for since we've been moved out here. And yeah, like I said, just a few years ago, I just kind of really wanted to do something on my own and started researching this because it just was kind of it was sad to see how many patients were so overly medicated but not really
Ah,
feeling well.
my
So,
goodness.
yeah.
Well, you say discover the power within you to overcome mental health challenges. What type of mental health challenges are people suffering with that ketamine could be of hope to and of help to, of course?
Right. Well, a third of the patients in the country are considered treatment resistant as far as depression. And depression is a major disability in the United States. So there's just not really a good correlation between all the medicines, right, that people are taking. We see a huge benefit with patients with treatment-resistant depression, anxiety, PTSD, the suicidality, just really, the ketamine cuts that very quickly.
Well, anxiety, I was reading about depression, and you say it targets, how does it work? How many sessions do you need? Tell me the process to start the therapy. How do you know what somebody needs, and how long of a process is it? Or is it ongoing? Is it a few months, few weeks? Normally, what is treatment and the process like for someone who may be interested?
Yeah, the patients who reach out to the clinic, if they have not received ketamine IV other places, what we recommend is we recommend an induction phase of 6 treatments over a 3-week period of time. That's really the most current research to resolve the symptoms. Then after that, patients may require a booster infusion every 4 to 6 weeks. Some patients haven't even come back for a booster. It really is patient dependent. There could be
Okay.
patients who are just kind of stuck in that therapy rut that the ketamine opens it up enough that they've gotten that taken care of and they're good.
So,
And then
okay,
there's some patients that
so once they're getting the IV, what is the process? Do they just sit there? Are they talking to you? Are they, what's the process? Or is it strictly the ketamine is helping them? Or is there also a mental health aspect where they're talking to someone?
what we recommend is that patients see their therapist within a 72-hour window of time, which is peak for neuroplasticity. We're very open
Ah,
here to however the patient really wants to experience it. The infusion runs over 40 minutes. They can bring their therapist with them. They can sit in there with a loved one. They can sit in there with one of us by themselves. And we check in on them every few minutes. They're comfortable. They're in a recliner chair. And they kind of just, we dim the lights. They want to listen to music, they can. Some people talk, some people just really just want to relax or sleep. Mhm.
oh my goodness. Well, also you mentioned that people out there who may be suffering, do they have to come to you with a medical diagnosis? Is there any, do you have to prove that you have an ailment? Like, is this covered by insurance? I have so many other questions.
Well, I'm not in the field to diagnose a patient.
Mm-hmm.
So I want to know if the patient is under the care of a
Got it.
therapist or provider. So
Yeah.
that's really what we ask for, is that something comes to the clinic so that we at least have a diagnosis code for them. And then we know that they're being followed
Yeah.
outside of here. Because here is really where they can receive the
Yeah.
ketamine the safest.
And you mentioned
It's not,
so, oh, go ahead.
no, you're fine.
So after the infusion, say for, I think you said 40 minutes, right? What happens after that? What is the process of leaving? Do you need someone to drive you home or is it out of your system? How does that part work? And what do you also, tell your clients the rest of that day to do?
So the patients do require a driver home. Um, After the infusion's over, within about 10 or 15 minutes, the patient's kind of, they're feeling a little bit better. They're a little bit more with it. They can get some water, or if they want to bring something that they like to drink, they can bring that. And then, yeah, then they need a driver to go home. So they're here at the clinic about hour 15 minutes or so.
And eating and drinking during the day, is there any restrictions or limitations?
We ask the patients not to eat for 6 hours before the infusion and clear liquids up to 2 hours before. And that's really to prevent any nausea because it can be a drug that can cause some nausea as a side effect.
Beautiful. Now tell me, ketamine is hope. When did you start this practice? And is it you alone? Did you have any partners? If you don't mind just telling us what it was like to start your own practice, that had to be a big undertaking, right?
Mm-hmm. Yeah, we've been open now since November of 2023. It was probably about a year and a half process getting everything ready. I have a collaborating physician. I have a nurse that works with me. We give the infusions here 3 days a week, and she's here with me. And yeah, but other than that, it's just me. Mhm.
Perfect. And let's talk a little bit about the infusions as far as, the price. Is it any of this covered by insurance or because it's an alternative therapy, it's out of pocket? Just curious about that.
The price is $375 per infusion. So if a
Okay.
patient's coming for their induction series, it's $22.50. Insurance, I don't take insurance. I take cash, credit card. I've partnered with Advanced Care Card, which offers a 0% financing opportunity.
All
And
right.
then at the end of the treatment, I give the patients what's called a super bill, which would have the diagnosis codes on it, and they could send that into their insurance company. Many insurance companies don't reimburse anything, but hopefully in the future that will change, right?
Yeah, no, absolutely. I agree. So
Mhm.
let's remind everyone at this time how we can contact you. Ketamineishope.com. That's the website. Do you want to share a phone number, any social media pages as well?
Yep. So I'm on Facebook, Ketamine is Hope. You can find my Facebook page there. You can email me at info@ketamineishope.com or go to the website and you can call the office. You can text the phone number also. It's 574-544-2283.
Perfect. Now, what about, let me ask you, obviously you started the company after the pandemic, but a few years ago we were faced with a huge mental health challenge, and I think that's still affecting many people. And as a nurse,
Yeah.
being in the healthcare field, would you mind just discussing that? And have you seen an uptick in anxiety? I mean, I hear this word
Oh, yeah.
anxiety all the time. Could you just share a little bit about, the COVID times in your life, with your career, and what you think has been happening?
Yeah. I mean, I think that it's caused a lot of anxiety and fear. And with that, everybody was not only just stuck at home, but they were on their devices, I think, a lot more. And I think that the internet and the phones are okay, they're great for certain things, but I mean, studies have even shown some issues with dopamine addiction. I mean, people are just, it's really causing a lot of anxiety in the population, just the constant scrolling and, it's just
Yeah.
not good for your brain to be that hyper focused on many different things.
And it's like, I think it's going to be, I have a 7 and 9-year-old, and they have older cousins and neighbors. And it's like everyone's on their iPhones, their tablets. It's nonstop. And
Yeah.
I feel like we don't really even know the long lasting effects of this yet because it's still
Mhm.
kind of a new modality. But I don't know how kids are going to work and focus without
Yeah.
putting that phone. It's just this is like a serious issue. Like we're talking about anxiety, depression, postpartum, but this could be a real thing. I mean, a
Yeah.
few years from now, I don't know what we'd call it, but you would probably know best. But like a phone attachment or something that's
Yes. Oh,
really.
yeah. It's an addiction, I think. Yeah. Yeah.
Yep, there you go.
Hmm.
There you go. And
Hmm.
now, does ketamine help with certain addictions as well? Speaking of addiction, great topic.
Yes. Oh, it does. Yes. Yes. And I've had several patients who, with addiction problems have come here and it's worked really well for them.
And what
Hmm.
type of addictions are we talking about, if you don't mind
Alcohol, drug
elaborating again?
addictions.
Okay.
Yeah.
And
Opioid. Yeah. Hmm.
could you share
Hmm.
a client story or two, obviously without using their name, but tell us a little bit about what was going on in that person's life and how it helped them.
Yeah. Well, I had a patient come with very, very severe anxiety and high alcohol use. And really within the first couple of treatments, a lot of the times with any addiction, what are they doing? They're self-medicating,
Mm-hmm.
right? They're self-medicating the underlying mental health
Yeah.
issue. And after about maybe two or three infusions, the urge to drink, was gone.
Wow.
Yeah. So there's a lot of treatment centers that are using some ketamine also. So there's huge benefit to it.
Got it. And what about those suffering from postpartum? I have kids, I have friends that have been going through this still to this day. Tell me how ketamine could help someone going through this. I'm assuming you help moms with this as well?
Yes, we have We have one patient in particular, yeah, she's postpartum depression, and she had it with her first child. And she knew she was pretty much resistant to a lot of the SSRI medications for depression. So
Mm-hmm.
after her second baby, the baby was maybe, a few months old, she reached out and started her ketamine journey, and she did her six, and she comes back, oh, maybe every 6 weeks or so. But yeah, huge benefit.
Amazing. And do you mind me asking you personal question? Have you ever suffered from anything that this modality helped you personally? Anything that you wanted to share?
Not me personally, family member, yeah, who's
Okay.
had struggled with some different medications and things like that, and I saw a huge relief from this.
Amazing. Well, it's so great to know there's other therapies out there. And how about someone dealing with suicidal tendencies? Is that something you've come across and have worked with people with this? Could you share some of those stories too to help them feel like, hey, there's more to life. I want to live.
Yeah, yeah, the suicidality, to be honest with you, that was another thing that kind of really hit home with me because currently the way the system is in a lot of hospitals, patients come in with a suicidal ideation and they're kind of put in a hold pattern.
Yeah.
Whereas there's tremendous amount of research out there that shows even a single dose of ketamine within 75 to 80% of the people in an acute suicidality can cut that.
Amazing.
So
And
I always like think to myself, like, why are they just sitting in a room unmedicated? You know, it's a drug, it's a safe drug
yeah.
that could be given. And we've had patients come in here that the suicidality is gone after a few infusions.
Well, I'm just curious, what are some of the signs and symptoms we should be looking for or looking out? Maybe if you have someone who's suffering, whether it's from, suicidal tendencies or depression or anxiety, what are some of the things that we could look out for to help our loved ones and our neighbors and our friends? What are some of the things that are, indicative of someone who may need this type of help?
You know, I think everybody's different in a way too, because, some people really retreat inside,
Yeah,
or somebody who's an introvert all of a sudden is an extrovert. Are they trying to hide something? It's not
true.
always really, maybe just a change in our person's acting, or
Yeah,
less interest in certain things
got it.
they were interested in before.
And what else, as far as I was reading that it can help with PTSD. Could you share what that is, who that affects, and then talk about how this has been used for that for a while? That's the first time I heard of it, actually, a while ago, was for someone who had PTSD. Could you share a little bit about that?
Yeah, yeah.
Thank you.
Well, interestingly, they show studies back in the Vietnam War era where they used to use, the ketamine. Because ketamine is used in wartime, and a lot of those vets would come home with less PTSD. So PTSD, I mean, the vets are really struggling with that, and just really a lot of different people in general. But the PTSD with ketamine, what helps it is that they're able to process the event better, and then speak to their therapist about it.
And what else for your first 30-minute show today do you want to talk about as far as your company, the people you're helping? What else did you want to make sure we cover for today's show in particular?
Just really want people to know that I'm very passionate about this, and I feel that so many people are kind of lost in the shuffle. And when patients come here, it's just not a six treatment thing. Me and my nurse really take a lot of pride in making the patients feel like a part of our family, so to speak. They can always message us. And after they left here, we really want to follow up with them to know how they're doing. Um, but yeah, just kind of really more of a just that they feel comfortable here.
Well, could you do you want to share some more stories of people that you've helped or talk a little bit about this is this, worldwide? Are people doing this more? Is ketamine therapy
Mhm,
becoming, like the statistics of it? I'm not even aware. Maybe it's something someone else, never even heard about.
mhm. No, it's becoming much more prevalent in in society, and people are, I think, realizing what it can do. And unfortunately, with the death of Matthew Perry, it kind of shed the light on
Yes.
ketamine just in general. But ketamine can be given various different ways. And IV is, of course, the gold standard. That's the best bioavailability there is. Um, Patients can also take it orally some other ways, but this is really the safest. You're monitored the whole time here.
hmm Was Matthew Perry, was that in pill form he was taking, or they found
Mhm.
them on him or something? I don't remember the full story, but just
Yeah,
curious.
I mean, the level of ketamine in his system was at about a general anesthetic level. So he had had an infusion a week and a half before that. That didn't cause his death because the ketamine IV is out of your system in 4.5 hours.
I was just gonna say it comes out.
Yeah,
So I mean,
yeah,
oh my goodness. So he was getting it. Is there? I'm assuming there's then an underground market for this, which we should be concerned
yeah.
and
Or who knows?
careful.
Maybe he could have multiple prescribers. I'm not really sure. I think that they're kind of delving more into that now.
Got it.
But yeah,
But use in small doses. Explain this again to our listeners. It is safe
oh, very safe. Hmm. Very safe.
and effective. When did
Hmm.
we, and then I think I also heard about ketamine. Was that, or maybe I'm thinking of the wrong anesthetic. Was it Michael Jackson? Was it him?
Propofol. Yeah,
Propofol. That's a different one. That was wrong
yeah.
then. Okay.
Yeah. Yeah, that was another one that, patients I would take care of patients. They're like, well, you're not going to give me propofol. I'm like, you probably already had it. Like it's not for home use, right?
Got it. Got it.
So yeah.
All right.
Yeah.
Well, also, where and when did people so it was used first as an anesthetic in
Hmm.
the OR?
Hmm.
When did this become, hey, this is beneficial? Who did the research? Who figured this out that this is beneficial to people?
Well, there's been a lot of research, but in 2017 is when
Oh,
the Journal of American Medical Association Psychiatry came out with a consensus statement stating ketamine at this dosage for treatment-resistant depression and other mood disorders. But when I've gone to some conferences, there's psychiatrists that have used this for more than 20 years in their
wow.
practice. So it's been known.
Amazing. Oh my
Yeah.
goodness. And just curious, you as a nurse and what field were you in originally before you came to this? What were you doing specifically? You're an RN?
I'm a nurse anesthetist. So I registered nurse and then I went back to did my nurse anesthesia training. Yep. So I've worked in various hospitals, had different, worked different surgery centers, outpatient centers. Hmm.
Oh, so you're a real advocate too for helping people like this, which is a beautiful thing. And in our last 2 minutes together, before we remind everyone how we can contact you, anything else that you want to share about you, about your company, and about the people you're helping?
Um, I just want patients to know too that if you do reach out, we make every effort to get a hold of you within a 24 to 48-hour time period. We take
Oh,
that really seriously because that's something in medicine that's really lacking, I think, just because of resources.
yeah.
But by the time patients have reached out to our clinic, they've also exhausted some other options. So that's a high priority to us to connect with them.
Great. All right. Well, thank you again for being here, Julie. If someone has any
Thank you.
questions, do they call you directly?
They can text the phone number on the website. They can email me at info@ketamineishope.com.
And ketamineishope.com is the website. And what is the phone number?
574-544-2283.
Well, thank you so much, Julie. Pleasure having you
Thanks,
here
Jill.
and getting to know you and all the benefits of ketamine therapy. And for someone out there who may be listening today who is in need of help, obviously feel free to reach out. And I hope this conversation helps to know that there are alternative therapies out there, and one in particular that proves to do very well. Hence, Julie's
Mhm.
here. And as a nurse, obviously starting her own company in this field over a year ago, realizes the benefits, and she's helping so many. Julie, thank you again.
Thanks, Jill.
All right. Have a great
Bye-bye.
day and a great
You too.
weekend. We'll talk soon, I hope.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.